You might be taking your medications the wrong way and not even know it. As a pharmacist, I see these 5 dangerous mistakes every day. Mistakes that can make your medication less effective or even cause serious harm, like mixing pills that don't go together, crushing tablets that are not supposed to be crushed, or taking meds at the wrong time of the day. Most people usually think the doctor prescribed it, so I'm fine. But here is the truth. Even the simplest vitamin C can cause serious harm if taken the wrong way. I'm going to show you the 5 biggest mistakes I see every day and what to do instead to protect your health. Mistake number 1. Taking drugs on empty stomach when you shouldn't. Let's start with the most common. Some medications like ibuprofen, diclofenac, pyroxicam, doxycycline, aspirin. These drugs can seriously irritate your stomach lining if taken without food. Another medications like metformin, an anti-diabetic drug, may cause nausea and vomiting if taken before food. So I will advise always check if your medication should be taken with food. And if you are not sure, ask your pharmacist, because that simple check can save your digestive system. Mistake number 2. Mixing medications with juice or soda. I know it's tempting, especially with children, but mixing medication with soda, grapefruit, fruit juice can interfere with how the body absorbs the drugs. Grapefruit juice, for example, blocks enzymes that break down your medication, which means that drugs like statin, calcium channel blockers may build up dangerously in your system. So of course, plain water is the safest for taking medications. No carbonated drinks except your doctor specifically approves it. Mistake number 3. Skipping doses when you feel better. This one breaks my heart. Someone starts an antibiotic, feels better at day 3, and abandons the antibiotic. Please don't do this. Stopping antibiotics early can lead to resistance, and the infection may rebound even worse than before. So I'll advise you always finish your antibiotics course even when you feel better, because that is how the bacteria dies entirely. Mistake number 4. Doubling up after skipping a dose. You may have missed your dose this morning, but what many people do is that they try to catch up by doubling up the next dose. Please don't do that, because that can lead to overdosing, especially with blood pressure medications, insulin, and antidepressants. So I will advise that anytime you miss a dose, check your medication guideline to see how you should handle it whenever you miss a dose, or you can talk to your pharmacist. Sometimes you should skip it entirely and not doubling it. Mistake number 5. Storing medications the wrong way. It's common knowledge that heat, light, and humidity destroy some medications, making them weaker or even more dangerous. I heard that some people store their medications in their bathroom cabinet. That is one of the worst places to store medications, because the humidity in that area and sometimes steam can actually destroy the medications. Store medications in a cool and dry place like your bedroom drawer, and always check expiry date, because old medications can be unstable and ineffective. Mistake number 6. Crushing or splitting pills without checking. I'm sure that many people do not know that some medications are designed with a protective coating and extended release formula. You would have seen medications with SR, XR, CR written on them. CR means controlled release, XR means extended release, and SR means sustained release. So when you crush or split them, you may destroy that release system and the medication hits your body at once, and this is very dangerous. So I will advise you never split or cut any medication except your pharmacist confirms that it's safe to split or crush. So ask questions before modifying any tablets, okay? Mistake number 7. Combining over-the-counter drugs without guidance. This is actually very tricky. People combine all manner of anti-allergies, painkillers, cold and flu medications without realizing that they may have overlapping ingredients. For example, taking cold and flu medicines with paracetamol, not knowing that there is already paracetamol in the cold medication, will lead to overdose of paracetamol, which can damage your liver. So I will advise you always read the active ingredients of over-the-counter drugs before taking them. Just because it's sold freely doesn't mean it's free from risks. I see these mistakes every day and they are all preventable. Just a few modifications can help your drugs work better and save you from unnecessary side effects. Which of these mistakes surprised you the most, and have you caught yourself doing any of them? Please let me know in the comment section, because I reply every single one of my comments. If you found this content valuable, please don't forget to like, subscribe, share this video to someone you think that needs it. I'll see you in my next video. Bye.